we've talked a little bit about adrenal and what and how it works, but let's talk. It's kind of tangenting a little bit, but how then does adrenal display? So this is less about family planning now and more about adrenal, and how does that present then? And what are the, because it isn't just to do. There are other reasons, presumably, that ferrets can get adrenal, but how does it?
Oh, it's nearly always related to. I have seen it in unneutered ferrets, but not often. I've got little Jill here who's got who's developing classic adrenal. She's about 8 years old.
Mm-hmm. And is she's neutered?
Yeah, she's one of our old ones that we had neutered when she would have been 6 months old. So she's just developing it. It does seem to be a lot more common in females. Andy's just fetched her for me.
Yay! Thank you, Mr. Betts. Hey, there we go.
That's Branston, excusing her nails that need a trim. I don't know if you can see, but she's looking very sparse on her tummy.
Yes.
Her back's not so bad, although she is developing the baldness on the flanks.
I think you can see it's starting to thin a little bit on the flanks.
Yeah, it's just getting a bit thin, and another on her shoulders as well.
Is that part of it classic as well? Is it?
Yeah. Right, now we've got the right one. Bye, darling. You go. So she's not coming back into season because sometimes the vulva swells, and it looks like they're coming back into season again, and you're thinking, hang on, but hers hasn't. But she's definitely adrenal, so we'll just get an implant.
And the implant is literally balancing the hormone levels back to where they should be, which is why it's more easily treated. Is that correct? Or
yeah, what it does, it's the hormone injection that they use, the implant, is exactly the same as what we give men who have prostate cancer. And it can be used for women who've got endometriosis as well. I tell you, it's all the same drugs that are just used throughout. That's why it's the same kind of, yeah. And it suppresses the production of estrogen and of testosterone, primarily testosterone. But it does work very well for adrenal.
I'm trying to think that through in my head, see if I understand. So, because
don't ask me all the technicalities about the cycle of productions and
no, God, I wasn't. I was just thinking, hang on a minute. If they've already been spayed, that means that they're not going to have as much estrogen.
It's more to do with the because women have testosterone as well.
Yeah. So it's more it's actually almost to suppress the amount of testosterone. Because the adrenal gland is diseased, it's starting to pump out and produce. Right. I'm forgetting that bit. Yes. So it's then that is just balancing the adrenal gland a little bit more. I'm with you. So the way that adrenal presents, and one of the things you might see, and one of the hints that your ferret might be starting to get adrenal, which is certainly not something to I suppose it's a worry, but it's certainly not the end of the world, and it's not it's not the same as recognizing your ferret suddenly has lymphoma.
And it's one of the so with the amount of old Jills that you sort of think they're getting a bit thin coat, and you can always tell because they feel hot when you pick them up, and the reason they feel hot is just because they haven't got as much fur, so you're holding the skin as opposed to having an insulating layer of fur, so they feel hot. And I pick them up and I think and you can look at the coat's getting all thin. So it's that thin coat, and it's the coat that thins on the flanks around the kidneys, if I remember, isn't that? It can be, and it can be on the shoulders. It's symmetrical, so it's going to be the same both sides. If you get one that's only got on one side, hair loss just on one side, or just more of a localized patch, it could be something else. Right. Some vets I know do blood workups and everything for diagnosis, but generally it's something you can see just by the clinical symptoms.
Right, okay. And how about the tail? Because I know obviously a lot of ferrets have rat tail, but I've had a few people, and I don't know a great amount about it, touch wood. I've been very lucky. Well, I haven't been lucky. A lot of my ferrets have died of other cancers, but I've been lucky that none of my ferrets have had adrenal. So I've seen it in other ferrets, but I'm not a first-hander where things, God forbid, like lymphoma and some of the other ones, sadly, I am a first-hander at. So, you know, rat tail, is that?
Rat tail's not, no, that's not connected to it.
So, because obviously ferrets just get a rat tail from molting, yeah. But some people have been like, oh, they've got a ratty tail. Oh, does that mean anything? So rat tail, you know, they're not going to have a rat tail. It is that they're going to thin on the body.
As long as the body's fine, just the tail in itself isn't a problem.
Right. Yeah,
you can sometimes
the tail is gone.
Yeah, it starts going from the tail up the body.
Yes, but the tail on its own, then you don't necessarily need to worry unless it starts spreading, and that's the hint that it's right. Yeah, because obviously, you know, rat tail is. I mean, Hooligan had rat tail for 2 or 3 years in his last years, as did Chili and Peps, didn't they? Really, and it's part of the molt. You know, little spooks is getting a bit of a ratty tail as well, and it is what it is. It's just a molt, but I wasn't quite sure, so that's really interesting for me as well. How about, are there any other signs in terms of their behaviour, or is it all just
they can get start eating more, get slightly more animated. The boys, and so boys don't tend to suffer as much with adrenal, though I have seen adrenal hobs. They start just getting a bit more aggressive, just bullshit, like exactly just like the testosterone's coming back.
Oh, right, okay, yeah, well, yeah, that makes sense. So they're almost becoming like teenage boys again in their latter years.
Yeah. And obviously because you've taken
more attitude then as well.
They just get. I mean, I've noticed Branson's a lot more. Not frantic, that's not the word I'm looking for, but just she's a lot more animated.
Right, okay, literally animated, yeah. And so what you said before, I just want to reiterate for my own benefit to see I'm understanding this right then. So generally adrenal is only going to be present in an animal that's been neutered, because that's what's throwing out and diseasing the adrenal. Generally.
Although I have seen adrenal disease in ferrets that haven't been neutered. So, but again, you know, cancer can come up.
I was going to say that, but again, it's that is because it's a cancer and it can throw up anywhere.
Yes, it could come up, but it's unlikely. It's less likely in because you haven't got the disruption of the hormone so much.
Right. So, and then going back as well, and you mentioned females might. Did you say females might look like they're coming back into season?
Yes, they could. Yes, the vulvas swell, very much like the picture you put up.
Right.
They can, but again, not all the time. It's usually the hair loss is the thing that you see.
Yeah, and sorry, go on.
If they look like they're coming back into season, say about a year or a few months after you've had them neutered, but they haven't got the hair loss, don't necessarily jump down the adrenal line. It could well be that there's been a retained piece of ovarian tissue which is still working,
which is throwing everything a little bit.
Yeah.
And is that something that you really need to get seen? I mean, I presume that the advice would always be get it checked out to be sure.
Yeah, I mean, go back to your vet and say, you know, this ferret was neutered 4 or 5 months ago, whenever, and is coming back into season again. How come?
What about?
No, what's happened? And then whatever happens, it's almost like a flow chart. Whatever happens, the end point is always use an implant, because even if there's a retained bit of ovary, well, you could open your ferret up. Okay, so that's subjecting her to another major bit of surgery. In a way, it almost not that important what's causing it, because if you put an implant in, it'll deal with it anyway.